Welcome to Estetica Beauty and Science podcast. We are very excited to have a special guest today. Our guest is an internationally recognized expert with more than 200 published scientific papers in the field of plastic and aesthetic facial surgery, and the author of several books on facial plastic surgery. He is Professor Dr. Peter Lohaus, a Dutchman with a special bond to Croatia and with the reputation of one of Europe's greatest experts in the field of rhinoplasty. Doctor, welcome. It's great to have you here.
Thank you. Nice to be here.
With Dr. Felipovic from Zagreb, you created the concept of a modern polyclinic. How did you make the decision to come to Zagreb and start your practice here?
I was working in, I'm still working in a head and neck center for cancer, where I do resections and
in Amsterdam?
In Amsterdam, yes. Where I do resections and reconstructions, and I was also working in an academic center and a private clinic where I did a lot of, where I do a lot of aesthetic work in Amsterdam. And I always had fellows, and Dr. Felipovic, he visited me for 1.5 years.
He was your student?
Yes, and we became friends, and I always wanted to start a private clinic. And I also saw the healthcare environment in the Netherlands change to something which was not slow in the hospital, but more oriented to focus groups, like for example, aesthetics, incontinence, headache, that kind of thing. And then we talked and we saw a possibility to arrange that in Zagreb as well, because the healthcare system here is suffering, and we would like to focus more with high specialized doctors on certain areas, so you get a lot of volume and higher quality. For example, we are working on incontinence now. I think a lot of women are walking around with incontinence after many pregnancies, and it's easy to fix as long as you know that it's possible and you have a high standard of surgery in that direction. So we started here, and I think in November 2018 we opened, and I think we are doing okay and becoming more successful. Are you happy here?
Yes. Yeah. Can you compare some trends in your country, in Amsterdam, and in Croatia, maybe in Zagreb?
Well, what I think is that this country is ready for implementation of the North European system as we speak. So it's necessary, it needs more efficiency, the way the healthcare is provided, and how they arrange the financials around it needs change. And it will come, because it's something that the younger generation wants, and therefore the political situation has to kind of arrange it.
Okay, nice. Today more people than ever decide to have rhinoplasty for aesthetic purpose. Do you believe it is driven by Instagram selfie culture and meetings via Zoom?
Yes.
It's popular now.
I think so, a little bit, because people take a lot of selfies. It's like a mirror, they see themselves, and they also see that maybe there's a little fish eyeing when you take a picture of yourself, because of the cameras. The nose will look bigger. Okay. And therefore they think, all right, the nose doesn't fit my face and I want it smaller. The bad thing about it is that surgeons try to exaggerate a little bit. They make the nose that small that it looks well on Instagram, but when you are with your family or you're in a grocery shop, it looks operated because it has a scoop, etc.
And it's too small.
It looks too small, yeah. So that's a thing you have to kind of explain to the patient, that it's best in the end. The older you get, you want to have a nose which looks unoperated, but still better than it was.
And an old one.
Yeah, that usually means that it disappears in the face. So when you make a big nose disappear in the face, or a deviated nose, then the eyes, the lips, the hair will come out better. And that's the result you're seeking for, a natural result with a less obvious nose.
Is it true that the nose and ears grow our entire life?
Maybe for men it will grow, and it's true that when you get
Just for men?
You see the ears growing, and usually the skin gets more sebaceous, so it seems like everything is getting thicker. But I think especially what happens is that the relation between the dorsum and the tip, it gets a little bit weakened, so the tip starts to droop, and when you smile it gives this typical derotation, and that's why people say, all right, when I want to get older I don't want to have the nose that my mother did, but usually what happened was that it gets weaker, and it's just a matter of, you know, fixing it in a more upward rotated position.
Okay, we have a plastic surgery now, so it's easier. Can we, and what extent, know in advance what the nose will look like after surgery? Can
Yes,
we know that?
yes. Well, it's like this. What you can do is you have a morphing program,
Okay.
where you can see how the nose will look.
On your face?
I don't like it so much because it looks perfect.
Okay.
When you do it, and also it doesn't mean that when you can do it on the Photoshop that you can create it in real life, so that's something difficult to promise. What we do is we have a website where we have a lot of examples of real noses which we performed the surgery, and you can always find a nose which looks a little bit like you, similar, and then see if you like the result.
Yeah. How important is the sense of aesthetic plastic for a plastic surgeon? That is, can you be a great operator plastic surgeon without an aesthetic eye?
Well, if you do a deep plane facelift, for example, it's something that you have to know about vectors. You pull as hard as you can, and then usually you get kind of a good result. The problem with rhinoplasty is that the variation of noses is so large that it's always different. So, and also you have to have a sense of feeling that the nose fits the face. So I always say there's the 3 A's, which is academics. You have to know a lot of stuff about the nose. You can give a course for 3 days and it's not boring. You have to
you have to handle with the blood.
So yeah, you have to go. And the second thing is you have to have some sense of good fingers, right? But it's decision making also, that you do make the correct decisions during the surgery. But the last part is the RD, the RD part. And you have to have a sense of feeling how the nose will fit the face, because what you create is something which is your taste. With surgery you work towards a goal, and your goal is what you try to create. So in the first place your goal should be okay, and that's the artistic feeling that you have.
What if the nose is too small after surgery? Can it be fixed?
Well, in some cases it can, but nowadays you see a lot of noses come back from Turkey, which they did a lot of resection. It's not restructuring, but it's resection. It looks good for a while, but then it starts to shrink. They get small, they get scooped. That's really hard to correct actually, because you need a lot of cartilage in order to build the nose up again, and that's not so easy. So revision surgery is, already more difficult than primary rhinoplasty. The trick is to do your revisions during the first surgery, so it's done in one time well.
Yeah, I understand. Nasal tamponade is frequently mentioned on various forums. Do you support usage of them?
There's always some leakage when you open up a nose for a day. So I think you need dressing for a day. What we usually do is we give foam dressings for a day, which are easily to remove the second day, so no big...
Oh, the second day you remove
Yes,
it?
second day. Well, the day after the surgery you can move it. When it was bleeding a lot, all right, you wait 2 days. It's not big gauzes you have to draw out. It goes very quickly, and it's not so uncomfortable. Usually they sleep well, and it's okay. When they cannot stand the tampons, then you have one bad night. You look Netflix and you'll be okay.
How long does it take for nose to get to final look after surgery? Maybe days or months or maybe a year?
Yes, it's different. It's like, I always tell them before surgery, you take 1 week off at least, because then you're for job, so then you're healing.
Okay.
If it's comfortable, you need to have 2 weeks, because then after 2 weeks nobody has to kind of see that you had the surgery, but then it's still healing. After 3 months you see the patients, then you know, all right, was the job well done, yes or no? It's kind of healed very nicely, and after 1 year you have the best result, because the skin starts to get thinner and thinner over the newly created nasal skeleton, and you get more definition. But some people are already great after 2 weeks, so it's completely different in each patient. When you have thicker skin, that usually means it needs a little bit more longer time to get a proper definition. But after 2 weeks, you can go to the supermarket.
Can you put, after 2 weeks, the sunglasses on?
Yes.
No.
Yes? Yeah, more or less. Because what you do is you kind of break the nose, but the nasal bridge you create strong. It doesn't drift. And otherwise you use a small bandage to get the glasses a little bit higher.
And when can you sleep on the tummy?
On the tummy? Well, it's never a good idea to sleep on the tummy. When I say that as a somnologist. But
why?
Because the possibility of breathing stops is a little bit higher and it's not so comfortable. Most people sleep on the side or on the back. So I don't think a lot of people will sleep on the tummy when they had a rhinoplasty.
Okay. Give us an example of a Hollywood actress with a great nose surgery, and maybe example of a bad one. We can start with a good one.
A good one. I think that Angelina Jolie had a rhinoplasty at the beginning of her career. I think most actors have it at the beginning of their career. I think it's not a perfect nose, but it's a nose where it disappears in the face. She has great lips, great eyes, good bony features. So I think that's a well done job, because it's not noticeable and it doesn't look operated.
Yeah, and the bad one?
A bad one, I think, are the noses where they make Afro-American noses look very small, like Michael Jackson and the sister of Michael Jackson. You see the scars, it looks funny, it looks scooped up. That's I think looks maybe good on pictures, but when you see them from a mile you can see, all right, that was operated. Nobody wants to look operated.
And Nicole Kidman's nose?
Nicole Kidman, I think that's a little bit too much. Yes, that's too much. It makes her look funny. Now she gets older, they want to keep on looking great. It's better to gracefully become older and natural, but you know, they want jobs, and for the camera
it looks good.
Yeah, it looks better, and it's a choice.
Yeah. If you remember the movie Dirty Dancing, it's rumored that the career of the lead actress, Jennifer Grey, do you remember it? Went downhill after her nose surgery. Would you agree, given the fact that her nose was a most prominent feature?
Well, that's the danger. When you have a nose and it looks good on you, it's typical, and that shows a little bit how you are as a character. Don't change it, because people like it and it's a part of your beauty, and why then change something which fits your face? And that's the same with her. She was like a beautiful lady, like there are many beautiful ladies, but this gave her a little extra bite. Then she lost the bite, and then there's always somebody else they can hire for a movie who has that extra bite. So in her case, it was not a good idea. Maybe the nose looks better as an art thing, but not as a sales thing for her as an actress.
Is it necessary to go to a doctor's office to get lymphatic drainage after the surgery?
When you do surgery, you're going to have some swelling. What you can do is tape it to reduce the swelling.
For how long?
For like a few days, and then you just have to sit it out. When you do neck dissection, then there's bigger surgery, more swelling, and then sometimes you can rearrange the fluid to its different areas. I think that it differs between people. Some people have not so much edema in the nose, some people have. You cannot really influence it by kind of doing massage. I think that's just a waste of money. You have to sit it out.
Okay, you just have to wait.
Just have to wait.
For the very first time, you are organizing a Rhinoplastic symposium in Croatia. Tell us more about the special event.
Yes, we have a course. I did it for 10 years already. We last
Where?
time was in Utrecht. In Utrecht, it's in 3 continents. It's in Cali, Colombia, so that's South America. It's in Utrecht, the Netherlands, which is Europe. And it's in Izmir, Turkey, which is Asia. That's why we call it Intercontinental Rhinoplasty. What it does is it has 3 good surgeons with 3 different styles. This is South American, Afro-American noses, mestizo noses. This is Asia with Mediterranean and Asian noses. I do Caucasian and Mediterranean noses and North Africa. So you have 3 different styles mixing up. And it's 2 days of really well compressed lectures from experienced surgeons. We do it for 10 years already. And now what we did is, because we have the clinic here, we took the course under the umbrella of the Dr Felipovic Academy towards Zagreb. So now it's going to be first time here, and then it's going to be in 3 years. So it's like next year is Colombia again, then Turkey, and in 2024 it's going to be in Zagreb again.
Oh, nice. What's your link with Croatia?
Well, I like the country. I believe there is things to change here. So I think from a business point of view, we can be successful. I think we are aiming for a chain of clinics with not only aesthetics, but also medicine focused around certain subjects like incontinence, headache, pain, hand-wrist surgery, everything which can be done easily in private clinics with high quality and fast. So you don't wait for a year. No, next week you see somebody, we do the surgery, and you fix your problem. I think that this country is ready for that, and I think we can create something, because what we do is we just copy the North European system to this country. When politics want to work with us, then I think we can do something good for the country.
Doctor, thank you very much.
Thank you. It was nice to be here.
Thank you. Dear all, see you soon.